Okay, so this has not been my experience, but I can absolutely give you some helpful insight to help navigate through it. So, the medication only stays in your system for about 5 weeks, and that is pretty much average for everybody. Now, you could be a high metabolizer, you could be a slow metabolizer, but that is the general rule of thumb. We would never ever take a patient that is brand new to this and never had any dosing at all and start their dosing at a high dose. They're absolutely going to be sick. And that, I don't know what dose you're on, so that absolutely matters, but they would have to start on a starter dose. You at 4 weeks going in between are really no different for your body. That doesn't mean it can't be done. That doesn't mean that there's not some trial and error to it, and that doesn't mean that there's not people out there that are doing that and they're fine. But 2 and 3 weeks in between dosing for maintenance seems to be more where people land. That 4 week wait time is just almost a little too long, where there's absolutely no medication left in your system, and you really want some in there, because while your body does not get used to the medication, it adjusts to the medication. And so when you go so long without taking anything, your body is adjusting to that level of medication that is consistently decreasing every single week after your first shot. So a couple of things that I would suggest is, if you want to stay at that 4 week range, I would suggest lowering your dose and see how you feel. If that doesn't work, I would consider going 3 weeks in between and see how you feel with that. Hopefully that helps, and that kind of gives you a little bit to navigate, a little bit to think through, and maybe when it's time for you to take your next shot, you can have a little bit more success.